Now we're looking at the aspect of you want to do an imaging procedure for a patient and the patient has wounds. So what should you do? So here they say that a sterile gauze should be used in protecting those wounds. But I want to answer the question why. Because as medical professionals, we don't just do things because people do it. We have to know the reason behind doing that. You understand? This will help us to be able to, explain ourselves. So let me say this patient has what? A wound in the middle of the palm. Okay? So if I want to do imaging, probably the hand or any other parts of the body, why should I cover this with a sterile gauze? So first reason is what? Infection prevention. So barrier protection. So sterile gauze acts as a physical barrier between the wound and external contaminant. Like the patient is lying on the radiography, the radiographer will be examining the patient, so they are touching the patient, so you don't want a direct contact between anything and the wound. So reduce the risk of cross infection. So sometimes it could be that not infection moving to the patient, but it could be the patient having direct contact with the equipment and the personnel in the radiology department there, so thereby leaving infections on them. You understand? So it can lead to infection spreading to other people. So maintaining sterility. So radiography equipment cannot be fully sterilized between each patient. So covering wounds with sterile gauze ensures that the wound environment remains clean and controlled, minimizing exposure to non-sterile surfaces. So patient comfort and safety. Gauze will cushion the wound. So I don't know if you understand. It will be like a smooth landing. You don't want to be pressing the wound directly in contact with hard surfaces. That will cause pain. Okay. So preventing contamination of equipment. Open wounds may exude blood or fluids. So sterile gauze absorb and contain these secretions. It protects the wounds, the imaging rather, tables and dictators and positioning aids from contamination. So professional standards is infection control guidelines. Okay, emphasize that covering wounds with sterile dressing before procedures is good. So even if anything, you just have to respect those big bodies that set rules for us.